It's not simply, pull out a hair and plug it in there. There's a lot more involved in it.
Experience is critical and key
Yeah.
with this. Can you effectively transplant hair through scars?
Yeah, absolutely. And we do that all the time. It still never ceases to amaze me that doctors will tell their patients, that, oh no, there's nothing that can be done. That scar's that scar. And they'd either say there's no blood supply, but I mean, as you know,
There's blood supply.
there's definitely blood supply there.
Hey there, if you're coming across this for the first time, my name is Dr. Chafa. I'm a hair transplant surgeon, a hair loss coach, and I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. So I'm going to be answering this question. So my opinion, when we talk about hair transplant fits scar. So we're going to put it in two ways now. Are we talking about scarring alopecia? Or are we talking about just general scars from burn, from surgery or something? So now there are two ways to that. If it's scar from surgery, definitely you can get a hair transplant to cover that area. But you have to understand when they're talking about blood supply, how do we know if there's blood supply? When you make an incision, make sure there's blood. When we see blood, we know that there's blood supply. And another thing is that how much you have to transplant to that area. You cannot do a high density packing, cannot transplant a lot of hair in that area of scar. I always say you test out the area. So once you test out the area and let it grow, the initial testing, then you can go for the second hair transplant. And the second part is we're talking about scarring alopecia. So the same concept occurs in scarring alopecia. There's scar tissue, there's fibrosis. Before you attempt to do a hair transplant, in someone that has scarring alopecia, you have to make sure they're on the right medical therapy treatment. As I always say, you will always have scarring alopecia, but now is he under control? Are you on the right medication? Then after that couple of months, you can do a testing. The same way I talked about the other scar, you can also do test grafts, give few grafts and watch it grow. After a couple of months, 6 to 9 months, 12 months, we expect full hair growth. If the hair grows, that means you can also proceed with another hair transplant. That's if the person wants to go for a second hair transplant. But they have to understand that they have to be on their medication. So you have to manage expectation. Hope this has helped because when we talk about scar, I don't want you to get confused. We have to differentiate what kind of scar we're talking about. And until next time, bye bye.